So now is the second part, and this will be quite quick, I guess. We will talk more about this in detail. And of course, epidemiology, the idea of prevention is key. So I want to just go into a little bit about prevention, but as I said, there's a separate class about screening and other concepts related to prevention. I want to talk about the levels of prevention that we can engage in. Some of you may have heard this already. We have something called primary prevention. So the idea of the primary prevention is to take action to prevent the disease from occurring in the first place. Right? So something we do to make sure that there's no disease development in society or in the individual. We have secondary prevention, which is the stage where a person has not developed any signs or symptoms of the disease, but the disease biology, the pathology has already started somewhere in the body. So that's a second preventive measure we can think of. And then we have tertiary prevention. This is where there are obvious signs or symptoms and where we want to take action to rehabilitate or, in one sense, prevent any complications in those who are already developing symptoms of the disease. So these are the first three stages of prevention. And these are, of course, very important in the concept of epidemiology. And I have left this box here, example, empty. And you know what that means? That means I would like to ask you to tell me examples. So primary prevention, an action that is aimed to prevent the development of disease. Please give me an example of what that could be. See, I asked everyone on there. Ah, Sato-san. Can you hear me, Sato-san? Is it Saito-san? I have to go very close.
Sorry.
Oh, yes, that's my mistake. Saito-san, sumimasen.
No problem. Primary prevention. Vaccine is.
Yes, perfect. Vaccine is a primary prevention. Right? So we have numerous vaccines in society, and that's one example. Very good, thank you. How about secondary prevention? What is an example of secondary prevention? You say medicine, correct and incorrect, but it depends on the timing of the medicine. So I have to repeat because I realize the microphone doesn't cover everyone. So the answer was medicines or drugs. And I said it's correct, but it can also be incorrect. So it depends on how you develop that answer. So are drugs secondary prevention? If so, when?
Medical checkup is secondary prevention.
Medical checkup depends. It can be primary as well, but medical checkup can be secondary too. Very good. So that was. I don't have the contact lenses next time. Yazawa-san, I can't have the glasses because the mask just fogs everything up. So Yazawa-san, you said this health checkup, correct?
Yes.
Yes. So initially, health checkup was started in Japan to initiate primary prevention, but health checkup can also be related to secondary prevention. So developer, when would the secondary prevention be related to the checkup, Yazawa-san? When would the secondary prevention be related to the checkup? Okay, if I make it like this, if you can I ask for your name? What is your name? Shota. Shota-san said drugs or medication, and you said health checkup. If you combine those answers, when would a medication be an example of a secondary prevention? So you have a health checkup, and then something is seen, and the person gets a drug. when would that be a secondary prevention? What is an example of that? So I'll leave it to anyone. What point? Not only others.
Exercise or so when we are not taking a mask to prevent.
Okay. So, if I will address that in a moment. So I just want to finish the reasoning of the drug. So if you have an annual health checkup and you discover high cholesterol in a person who has not developed cardiovascular disease, the high cholesterol we know may develop cardiovascular disease. If you give that person cholesterol lowering medication, that'll be secondary prevention. Cholesterol is already high, so the drug will reduce the cholesterol, but it will prevent the cardiovascular disease. That's secondary prevention with a drug. If you give a drug to someone who has had a heart attack, it's tertiary prevention, because the person has already had the disease and you just try to reduce the complication and improve the prospect for the person. So that's one. When it comes to mask, secondary prevention? No, it is primary prevention, because we do not have symptoms of corona, if that's the purpose of the mask, of course. We want to prevent infection with corona. And of course, research will make a discussion whether a mask is good or not, but the idea is that it's a primary prevention. When we talk about secondary prevention, is there anything else that is more clear to be a secondary prevention? Yes, cancer screening. So let's say mammograms for women. The biological disease process has started. We can see it on the X-ray, and we can treat the patient without any symptoms of cancer. So that's a great idea. Colorectal cancer similarly, right? And then finally, tertiary prevention. We talked about it. You give a drug to someone who has had a disease, and that's tertiary prevention. So my idea now is to, I think there are 10 slides here. So just quickly, one by one, maybe we can go through and talk about what would this be. I've written SARS-CoV-2. I think the research is getting a bit, we're not really doing this type of prevention, so I probably put that in brackets. But theoretically, why do we want to vaccinate against any disease? In this case, SARS-CoV-2. Which type of prevention level? Primary, okay, good. So primary prevention, right? That's the idea of vaccination, whether it's polio or measles or rubella, anything. We want to make sure the disease doesn't develop. Nowadays, vaccines against cancer may be possible as well. That's the main. All right, a rehabilitation program after someone has had a stroke. What would that be? In the back. Tertiary, yes, the person has had the disease. What we're trying to do is help them regain their function and reduce any complications of the stroke. We know there are multiple complications, so rigidity, stiffness, and all that. Treating depression with antidepressants. There's only one person who can answer that. So I'll go to you, your specialty. Tertiary, yes. We have already defined the person has a disease, I mean, mental illness, depression, and we want to treat it. Very good.
Is that directed therapy?
Pardon me?
Is that, yeah, I got it.
Okay.
Yeah, the antidepressant can be the direct therapeutic, but it can also be a preventive.
It can be preventive because it depends what you want to prevent, I think. I mean, but if a person has been diagnosed with depression, then the disease has already had enough symptoms to develop, right? So we would be treating something specific and trying to reduce any harm from that, suicide, let's say, or social withdrawal, or allowing them to go back to work and enjoy. So it'll be tertiary in this sense. Okay, how about this then? The counseling efforts to reduce risk of sexually transmitted diseases. So counseling someone, informing them of the risk of disease, what would that be? In the very back. It'll be tertiary. Why? So if let's say there's a policy, a prefecture decides we will need to inform our inhabitants about the risks of sexually transmitted disease. Would that be to only people who have sexually transmitted diseases? Or would the community be different? At what point would you ideally want to have this? The ideal point to have this counseling. Anyone else? Primary, yeah. So you want to make sure you prevent, you give information about a disease to change that lifestyle or the habits of people, and therefore we can change this, hopefully for them, making sure no one gets the disease. And then mammogram screening program. So, Watabe-san?
Yes, I think mammography screening program is secondary.
Secondary prevention, yes, very good. So it's a secondary prevention, just like we explained before. How about the fecal occult blood test? So looking for traces of invisible blood to the eye in our stool. So we do this on health checkups as well. What would that be? And Nakahara-san?
Actually, I don't understand fecal occult.
Okay, yeah, so fecal occult. So occult means hidden. It's not visible to the eye. And fecal means in our stool.
So it should be primary or between primary and secondary.
Okay, so a person who has hidden amount of blood in their stool.
So secondary.
Secondary prevention, because there is something going on which the person doesn't feel and cannot see, and therefore the signs are not there yet, but some biological process has started. So it's secondary prevention. And of course, with this prevention, if it's discovered, the person can go for colonoscopy, for example, and have a more detailed investigation about this, see what the reason is. How about adjusting the insulin dose for a diabetes patient? What would that be? That's it. Yes, the person has already got diabetes, they need the medication, maybe something is happening, there's a change in the disease. And very good. How about this then? The legislation against smoking in public places. So forbidding the smoking in restaurants or bars. What type of prevention is that? Primary prevention. Very good. And of course, the reason is that we want to reduce smoking in society. So that means people who have not yet started smoking have a chance to not start smoking because there are less places to do that. In one sense, it may also be, I wouldn't say secondary prevention because it means there's a biological process already going on, but hopefully it can reduce smoking overall. So people who smoke, they decide to give up because they have nowhere to smoke, right? So, but it's still aimed as a primary preventive effort. How about an appendicectomy, taking out the appendix? So conducting an operation and so on. What would that be? Tertiary, yes, because the person clearly has a reason to do that. I know that before laparoscopies, if someone had a suspected appendix being inflamed, and it turns out it wasn't inflamed, it was still taken out. That was before. And the reason for that is nothing to do with primary or secondary prevention. It has to do with, because the person has a scar, because they've cut the skin, if in the future that person would not have their appendix removed, but have symptoms of an appendicitis, another doctor may think they've already had it removed. So that's why it was always removed, even if there was nothing going on. But ideally, it's a tertiary prevention. So how about this then? Initiating cholesterol-lowering treatment. So this is related to a medication, a drug. So you want to reduce the cholesterol in a person. What is it? Yes. Tertiary. Or Secondary or both? Oh, so trick question. But it's related to what we talked about before. In combination with what Yazawa-san said, if we have an annual health checkup, it's a generally healthy person. They have high cholesterol levels, too high, of course. That means they can get a cholesterol-lowering medication, preventing heart disease, so it's secondary. But a person who has had a heart attack with high cholesterol, they would have a tertiary prevention because the disease has already occurred. So that's one. Yes, after health checkup, like we said, and after MI would be tertiary. All right, so examples clearly. Vaccinations, reducing exposure to risk factors such as smoking, secondary screening programs, and tertiary prevention with rehabilitation or treatment.